Ma'am, and to start the program, we need one nice speaker, motivational things, because most of the time we are in our daily life, we're not able to hear somebody very good. So we are planning to call somebody?
Yes, sir. ಅದರ ನಿರೀಕ್ಷೆಯಲ್ಲಿಯೇ ಇರುವೆ. ಸ್ಫೂರ್ತಿದಾಯಕ ಮಾತುಗಳು ಸೋತವರಿಗೆ ನೋವನ್ನ ಮರೆಸಿ ಗೆಲುವಿನತ್ತ ಮುಖ ಮಾಡುವಂತೆ ಮಾಡುತ್ತವೆ. ನಾವೀಗ ಅಂತಹ ಸ್ಫೂರ್ತಿದಾಯಕ ನುಡಿಗಳಿಗೆ ಕಿವಿಯಾಗುವಂತಹ ಸಮಯ ನಮಗೀಗ ಬಂದಿದೆ. ಈ ಕಾರ್ಯಕ್ರಮವನ್ನ ಆಯುಷ್ ಮಾಧ್ಯಮದ ಮೂಲಕ ಪ್ರಸಾರ ಆಗ್ತಾ ಇದೆ. ಮನೆಯಲ್ಲಿ ಕುಳಿತವರು ಕೂಡ ನೇರವಾಗಿ ಈ ಕಾರ್ಯಕ್ರಮವನ್ನ ವೀಕ್ಷಿಸಬಹುದು ಸರ್.
Okay, thank you for this very good note, ma'am. Ayush TV is covering us on live. Then I take great pleasure in introducing an epic mentor, Dr. Sanjeev Nair. I need little claps, if you don't mind. Ex-VP of Reliance, a strategic leader and a strategist guru for education and development of all skills as well as the studies. Updated transformist, we can call him. He's amalgamation of his multifaceted inner engineering from risk management, student training and whatnot. I think so. I had 17 pages of his biodata. I'm scrutinizing it, sir. I'm extremely sorry for this. And he's blended with the epic Jugalbandi, CEO of Asset, presently a qualified theatre artist too. I think so. We need a little chapale for that. Yeah. And he's acted in different roles of Ramayanam and a great disciple of Guru Gopinath. We proudly call him on the stage with some nice music, please.
Sir, Dr. Sanjeev Nair, ಈಗ ವೇದಿಕೆ ನಿಮ್ಮದು.
ಚಪ್ಪಾಳೆ ಇಲ್ಲ ಅಂದ್ರೆ ಮನುಷ್ಯ ಬರೋದೇ ಇಲ್ಲ ಅಂತ ಕಾಣುತ್ತೆ.
Hi, good evening, namaskaram, respected gurus on the dais as well as, respected gurus and teachers on the audience. I'm so privileged to be here. Thanks for the invitation, Enipoya University senior leaders, and also Mr. M.K. Soban and Satyanarayana media consultant, and other distinguished guest present over here. A big namaskar to everyone. Thank you. Thank you very much, Karthikeyan, for a very nice introduction about myself. I'm so privileged to hear about my theater talent experts. Of course, I'm so proud because every year I used to go to the United States, as an IA study member, American Society for Training and Development. Normally, I used to give a simple explanation that for getting a PhD in engineering or management, it is easy. If you are a 4 years graduate, then after that 2 years post-graduation, then after that you can go for any management or any engineering or anything. Then you will get 2 to 3 years, you will get a PhD. But I learned classical theatre from Nadana Kalanidhi, Nadana Kala Chakravarti, Natikala Regnam, Dr. Guru Gopinath. He is my guru, which is more tougher than any engineering PhD or management. So rigorous training on, theatre, classical theatre and all. Here what we are going to talk about, little bit about the concept of cancer, consequences and support. Little bit about, I don't want to explain bit in detail because the time is maximum 10 minutes. I'll be explaining bit in 100 different types of cancer, source National Cancer Institute. I obtained some information, some salient and vital information from the net as well as, some of the books. That's what I thought of explaining and presenting over here. And activity, occupational exposure, and viruses and other biological agents, reproductive factors, alcohol, etc. These are all the causes of cancer, which we don't want to make it happen. Think twice, thrice, and many times, about all these kind of different causes of cancer. High-risk populations, poor, less educated, racial and ethnic minorities, persons with a family history of cancer, elderly people and all, that's also very important. And consequences, high healthcare costs for treatment. Of course, Cancer is not just like a normal fever or anything and all, this a lot of investigation is required, and plus, then subsequent treatment is also required. Lost work productivity, insurance denial, disability, psychosocial problems, treatment complications, example, increased risk of second cancers, premature mortality. So think 2 times, 3 times, 4 times, and always you have to think about this one, it's not a fair idea about that one, just side effects, physical, chemotherapy, radiation effects, pain, nausea, vomiting, fatigue, anemia, infections, fertility, and sexual side effects. No need to explain in detail because everybody knows it. If you search in Google, if you search in any books, the basic facts of cancer, this is, of course, emotional, distress, anxiety, fear, depression, coping with the loss of loved ones. These are all the side effects. We don't want to make it happen. Think. So here, cost, lot of hidden cost. Health insurance premiums and non-medical expenses, transportation, child or elder care, housekeeping assistance, wigs, etc. Cancer has the most devastating economic impact of any cause of death in the world. Worldwide economic cost of cancer is $895 billion. Cancer cost, the United States has estimated $263.8 billion in medical cost and lost productivity in 2010. Now, definitely, if you look at the history, it is increased, and some areas it is decreased also. With the growth and aging population, prevention efforts are important to help reduce new cancer cases, human sufferings, and economic cost. So, these are all the costs. If you look at the reason of cancer, and how you can eradicate, how you can control, how you yourself keep yourself fit for any kind of, for obstructing this kind of diseases, that matters a lot. Effect of cancer prevention, avoiding tobacco. It's very, very important. Please, please, please. This is very, very important. Limiting alcohol use based on the medical officers or a medical director or normal doctor, just you can go there and see that, how you can consume this type of things. Limiting exposure to ultraviolet rays from the sun and tanning beds. Eating a diet rich in fruits and vegetables. Because, this is nowadays, and especially boys and girls are here, a lot of school going as well as the college going children, their dietary, maybe poor dietary kind of things. A lot of things you can go there and buy in and consuming and all, fruits and vegetables, it's less kind of things. Maintaining healthy weight, being physically active, seeking regular medical care, screening, cervical, breast and colorectal cancers, of course, vaccine, HPV, and hepatitis. Guidelines for the early detection of cancer, breast cancer, this is especially for ladies. And early mammogram starting at the age of 40 and continuing for as long as a woman is in good health. Clinical breast examination, about 3 years for women in their 20s and 30s, and every year for women 40 and over. Breast self-examination, it's an option for women starting in their 20s. This is also important. Why I'm writing, these are all very simple tips which I'm presenting over here, just to see that, how we can control, how we can eradicate, how we can minimize the effect of cancer. Of course, early mammograms, which I already told. Who are cancer survivors? Cancer survivors are people who have been diagnosed with the cancer and those people in their lives. Who are affected by the diagnosis, including family members, friends, and caregivers, including the people who are how we can do this? This is a very important thing. How we can motivate, how we can satisfy, increase patient satisfaction, which is more important thing. 7 ways to increase the patient satisfaction, provide patient education, which is more important. And I'm so happy to see the Enipoya University, deemed to be the university, is mainly on health education, which has amalgamated a consortium of learning repository, which definitely people can. One of the very important thing is educate to the society, which is very, very important. How we can educate to the society? There are multiple ways of educating to the society. That is very important. Upgrade your systems, create easy feedback loops, improve patient follow-ups, protect patient confidently. Be transparent about visit expectations, focus on communications. There are 5 motivational techniques to help you achieve your goals. Set yourself a bigger goal. So goal setting is one of the, in organization management or even personal management or interpersonal skills. Setting goals and setting business objective is one of the very important things that we need to concentrate on, that kind of stuff, especially for cancer patients. Set smaller goals along the way. Do your research. Get support. Stay positive. Why motivation is important? Which is very, very important that patients' motivations provoke them to search for possible treatments and to follow these treatments in spite of their hardships and difficulties. So keep on motivation. Keep on motivate the people. That is a very important and it's a very vital fact. Therefore, it plays an essential role in determining the outcome of treatments and bearing its complications. 5 strategies to motivate patients. Encourage patients to own their health. It's very important. Physicians should emphasize good health comes from patients' actions, not from physician. Be on the same team. Don't overwhelm patients. Always follow up with patients. Explain healthy behavior is for patients, not you. Just for your information, during my theater profession, I got 2 best friends. They are cancer patients. But we are not treating them as cancer, affected people. Just like normal human being. How we are going to treat them, how we are going to deal them. They are dancing, they are doing in theater professions, they are doing in comedies, they are doing in dance dramas. My best 2 friends. That's good, So you did a good music because I was talking about the theater, so the music has come on its way. There are a lot of things it's going to happen, especially a lot of good singers are here, a lot of dancers is going to happen. I love to see that kind of stuff, which is more important, especially the affected patients, They are also a part of family. We need to treat them. The interpersonal skill development is one of the very areas which I mean to say is even during my long journey in outside India and within India, which I have seen that, how you are going to treat the persons, how you are going to motivate these people, especially the affected patients, that matters a lot. So please think of enhance the interpersonal skills, enhance their cultural activities, enhance their talents, enhance their sporting activities, and support them, and always be with them so that, that matters a lot, so the people will get motivated. Deal with cancer patients, taking with someone who has cancer, take your cues from the persons with cancer, show support without words. Choose your words carefully, very importantly. How you are being as a friend, like a human being, like other friends, how you are going to deal with this person, that is very important. Practice active listening. Use caution when asking questions. Make sure it is okay to give advice. Be honest about your feelings, but do not overburden. Keep the patients to be motivated. It is other than the motivations, what Karthik was mentioning about, I was stressing upon, the affected patients, how we can motivate. The American Cancer Society recommends 3 types of activities for patients to help stay positive. Don't go it alone. Involve other people. This is one of the areas which I was thinking that, we involve these persons, with, other than the day-to-day activities, how you can involve the people on cultural activities, theater activities, even dance, even 2 prominent film actors in Kerala, they are cancer patients, they knows it. I don't want to say that their names, but they are saying they are very coolly, they are doing their acting and plus, theater performances, etc. and all. That kind of motivation, they got it from the public and from the other, experienced mentors and gurus, how they get self-motivated. That is more important. Check the to-do list to-do list activities, activities that give you sense of accomplishment, like going for a walk or finishing project or ultimately positive. Cool it. Make it as it's a normal day-to-day activities, and how you can cope and how we can integrate with that kind of activities in their day-to-day activities, which is more important and vital. What motivates cancer patients? Optimism about the future of treatments, thinking positively. Confidence in treatments and relying on divine power create and strength healing motivations in cancer patients. And Anipoya, and I don't have the net, there are more, very, very importantly, in the first presentation, it has shown immense information about the health education. Give a big round of applause to the Anipoya University, who has given immense concentration on patients' motivation, especially patients' education, and the research center. And at a glance, I have seen, and before I come over here, I have gone through the university business objectives, goals and goal settings, and the various kinds of mentors, that is through professors and lectures, and how they are going to creating a lot of awareness about that kind of particular diseases, how they can eradicate and how they can control it with the help of various means and techniques in this university. And thanks to the organizers for organizing this wonderful program. And the heading is also very interesting: concerts for cancer-free life. Concerts. Concerts could be, of course, there are comedy shows and plus dances, that too in various forms, and theaters. That's very good. It is for what? It is to keep the people motivated, keep the people so happy, big smile, their big hearts. Hearts and minds is one of the very important facts, especially the people working in the industry. Hearts and minds. There are a lot of people, with affected people are also working in industry in an organization. And there is a separate clinical department. We are giving a lot of, intensive care for these people, and especially the great support, and we are treating them as a normal human being like any one of us. That is more important. And charity concept, just you imagine, we have got the organizations, a lot of organizations, they are mainly concentrating on supporting the people. And thank God, the initial prayers, and he has touched upon the charity. See, what is this? Generosity and helpfulness, especially towards the needy for suffering. That he has precisely mentioned, that priest has very clearly mentioned. Aid given to those in need received charity from the neighbors. An institution engaged in relief of the poor, which is very important. So charity is very, very important. Provision of help or relief to the poor. Alms giving, just to give a big arm to the poor. That helps a lot. So this is one of the slides which I have mentioned, one of the organizational management, how you are going to groom the graduate engineers, how you are going to groom the management trainees in the organization. Being me as a professional working in an organization, there's a big hand by the mentors and by the gurus to the new entry engineers or doctors or management, so that, it will be a great support. Normally, we have got a very well-structured curriculum, especially for the newcomers joining in an organization. Well-structured curriculum. It has got knowledge, skill, and most importantly, behavior. And remember these three important things. If you want to be a competent professional, you have to be knowledge-oriented person. And some people are very knowledgeable. They are very good talkers, but they cannot do anything. So skill is very important. Some people are very highly knowledgeable, and some people are very skill-oriented. But if the behavior is poor, then it's a big problem. So knowledge, skill, behavior, the combination of these three is known as competent. If you want to be a competent doctor, if you want to be a competent engineer, if you want to be a competent professional in the universe, these three things are very important. Knowledge, somebody is saying only knowledge is enough. Knowledge, skill, most importantly behavior, attributes is very, very important. So here, something given to help the needy arms, an institution, organization or fund established to help the needy. Charity is commonly used to describe an organization to facilitate charity benefiting people in need. It also refers to act of giving money, time or resources to others without expecting reciprocation. That means we need to serve the people, we need to support the people in terms of resources, in terms of money, in terms of alms giving, without reciprocating anything. That is charity. So definitely the organization here also, we are highly focusing for that kind of charity activities, and definitely we are all charity oriented people, which is very important, especially the cancer patients here. Not only cancer patients, anybody wants that kind of supports and aid, which is very, very vital, that we need to continuously on. And thank you very much for your active listening. That is most important thing. And think very importantly, the three things. We need to, how we can impart the knowledge, how we can impart the skills, how we can groom the people on a continual basis. Education is a never-ending process. People are continuously on. And most importantly, how you can enhance the attributes or the behavior of the people. If you have the knowledge, skill and attributes together in one bucket, then I am 100% sure that we will get the competent people. Our business objectives will be met in an organization or institution within our state, within our country, and globally also. So keep it in their mind, the three things. We need to support the needy people also. Charity is very vital. Thank you very much. Thanks for the attentive listening once again. Thank you.
ವೇದಿಕೆ ಕಾರ್ಯಕ್ರಮಕ್ಕೂ ಮುನ್ನ ಶ್ರೀ ಡಾಕ್ಟರ್ ಸಜೀವ್ ನಾಯರ್ ಇವರು ಸ್ಫೂರ್ತಿದಾಯಕ ಮಾತುಗಳಿಂದ ನಮ್ಮೆಲ್ಲರನ್ನ ಕ್ಯಾನ್ಸರ್ ಚಿಕಿತ್ಸೆ ಬಗ್ಗೆ, ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ಅರಿವನ್ನ ಮೂಡಿಸಿದ್ರು. ಅವರಿಗೆ ಡಾಕ್ಟರ್ ಎನಪುವ್ವ ಅಬ್ದುಲ್ ಕುನ್ಹಿ ಅವರು ಪುಷ್ಪಗುಚ್ಛವನ್ನ ನೀಡಿ ಗೌರವ ಸಮರ್ಪಣೆ ಮಾಡಬೇಕಾಗಿ ಕೋರುತ್ತೇನೆ. I request Dr. Sajeev Nair, please come over the dais. ಚಪ್ಪಾಳೆ ಕೇಳಿಸ್ತಾನೇ ಇಲ್ಲ, ಅಥವಾ ಅದೆಲ್ಲ ವಾಲ್ಯೂಮ್ ಮ್ಯೂಟ್ ಆಗ್ಬಿಟ್ಟಿದೆ ಅಂತ ಅನ್ನಿಸ್ತು ನನಗಂತೂ.
There is a very good band and many more dancers. I think so we need more sound with the less people.